Today, I come back to the floor of the Senate to talk again about the opioid crisis that has gripped our country and my state of Ohio. And I want to focus on the issue of fentanyl. This is the most deadly of the drugs now. It's the drug that is causing the most overdoses at a time in which we have unprecedented numbers of overdoses. Fentanyl is a synthetic form of heroin, of opioids. It's coming through the mail. It's coming mostly from one country, China. It is the poison that has contributed more in the last few years to the rise in opioid use than anything else. Over the past week, we've made some significant progress in pushing back against fentanyl, and I want to report on that today. First to say, as I'm talking today, the U.S. House of Representatives is going to take up legislation called the STOP Act that we have been working here in the Senate on for a couple of years. I'm very pleased about that. I suspect the vote today will be bipartisan. I suspect it will pass the House. I also want to report that here in the Senate, we've had a breakthrough in the last week. Not only have we negotiated something with the House that is, in my view, an improvement from the legislation that had passed the House Ways and Means Committee a couple of weeks ago, but also in the Senate Finance Committee this week. We had a markup and got a commitment from the chairman and ranking member of that committee that the Finance Committee will also mark up the same legislation, identical legislation, as is likely to pass the House of Representatives today. I want to thank Chairman Orrin Hatch and Ranking Member Ron Wyden for working with us to ensure that we could get this legislation marked up in committee and onto the floor of the United States Senate as part of whatever we do in terms of the opioid crisis here in the coming days and weeks. I also want to, of course, commend my House colleagues for the vote today and for the work they've done on this, particularly Ways and Means Committee Chairman Kevin Brady, Representatives Mike Bishop, Dave Reichert, Bill Pascrell, and John Faso for their efforts on this bill that combats the opioid crisis. Again, my hope is that the bill that passes the House today will be identical to the bill that we'll take up here on the floor of the United States Senate so that we can ensure that we can get this bill to the President for his signature as soon as possible. This is an urgent issue. This is not just an important issue, it is an urgent issue. We need to push back, and we need to push back hard. This drug, fentanyl, is so dangerous that a couple of milligrams of it, a few flecks of it, can kill you. And again, it's something that is causing the most overdoses right now. It's not just affecting, though, those who are overdosing on it, it's affecting all of us, including our first responders, including young children who come in contact with it. The stories are really heartbreaking of kids who are exposed to fentanyl, perhaps because somebody has left it behind at a party, perhaps because their parents or other family members have left it behind, and these young children are overdosing and dying. This has happened in my state. It's happened around the country. First responders are being affected. I hear the stories when I'm home, whether it's a firefighter or whether it's someone in the healthcare industry or somebody who is in law enforcement. A story that I have mentioned before is about an East Liverpool, Ohio police officer who pulls over two suspects. He notices that they're spreading white powder inside their car, trying to hide it. Wisely, he puts on gloves and a mask. He makes the arrest. When he's back at the police station booking these individuals, not for the traffic violation so much as for the fentanyl, he looks at his shirt and notices a couple of flecks of something white on his shirt, brushes it off like that. His fingers are exposed to the fentanyl, immediately falls to the ground unconscious, has to be revived by Narcan. Not once, not twice, but Chris Green, who is a big guy, 6'2", 200-some pounds, in great shape, 4 doses of Narcan were necessary to save his life, to keep him alive. And as his police chief said, if they weren't right there with him, what would have happened? And what would have happened had he gone home and had those flecks on his shoulder and hugged his kids? This is an incredibly dangerous substance, and we have to deal with it. Last year, law enforcement officials in Massachusetts said they revived a man with 2 doses of Narcan who said he'd only been smoking marijuana. How could this be? Well, it's because fentanyl was mixed in with that marijuana. I heard this last week in Lorain, Ohio. I was there for a meeting of a lot of folks involved in pushing back against this substance abuse problem, law enforcement, social workers, treatment providers, and law enforcement told us a story, very much the same. A young man who had to be revived by using Narcan, and he said, "I was just smoking dope." It couldn't be. And sure enough, when they checked it, they found out that the marijuana had been laced with fentanyl. It's also going into cocaine. It's also going into crystal meth. In fact, crystal meth now is becoming a bigger problem in my home state of Ohio, and we know for a fact that this is a bigger problem in part because it is being mixed with fentanyl. The Dayton area recently released its county overdose report. The Dayton area experienced 3 times as many crystal meth-related overdose deaths in 2017 as compared to 2016, and again, they believe fentanyl mixed into these drugs is the contributing factor. The county coroner from Cincinnati says that she has now seen fentanyl mixed with cocaine and marijuana, as well as a number of other street drugs. Fentanyl and its variants are now the deadliest drug of the opioid epidemic. One of the takeaways I've had from my meetings around the state talking to people about how do we push back on fentanyl is a growing consensus that we need to make much more progress in keeping the fentanyl from coming into our communities in the first place. We know, again, that this is what's causing the big increase in overdose and deaths at a time when we're doing more things back home to address the opioid crisis. And if not for fentanyl, I strongly believe we'd be making progress. We'd be seeing a reduction in overdoses. This body has passed the CARA legislation, Comprehensive Addiction and Recovery Act. It's also passed the CURES legislation, 21st Century Cures Act. I've been at a few different places in the state in the last few weeks where they're using that funding well to do things like quick response teams. When somebody is revived with Narcan, this miracle drug that reverses the effects of the overdose, then to be sure you're getting that person into treatment by working with law enforcement, treatment providers, and social workers together, and it's working. In one case, they're using funding from the CARA legislation, and 80% of the people who they are coming in contact with are going into treatment. That's a tremendous improvement, unfortunately, from what's generally happening, which is that very few people are actually going from the Narcan overdose, saving the person's life, into treatment. We've got to deal with that gap. So we're making progress, and yet the fentanyl is sort of overwhelming the system. So it's time for us to figure out how to push back and push back harder. Since 2013, in my home city of Cincinnati, we've experienced a 1,000% increase in fentanyl deaths. In the first 5 months of this year, more than 90% of the drugs seized by the Hamilton County Crime Lab contained fentanyl, more than 90%. Most of the drugs that we talk about, pushing back against, think of cocaine, think of heroin, even crystal meth, come in overland, mostly across the southern border from Mexico. What law enforcement tells us and what intelligence community tells us is that fentanyl comes in primarily by the U.S. mail system. So that instead of coming overland, and the need for helping to secure our southern border is clear, partly because of that, here we have a situation where this drug is coming in through our own federal agency, the United States Mail Service. They tell us it comes primarily from one country, China. So it's made in a laboratory in China, it's shipped over here. We spent about 18 months studying this issue. We went undercover, contacted a lot of different websites, and they all told us the same thing, which is, if you're going to buy from us, ship it by U.S. mail. If it comes by U.S. mail, we're guaranteed delivery. If you don't send it by U.S. mail, we're not so sure we can guarantee it. Why is that? Well, it's because 16 years ago, this body and the United States House of Representatives, after the 9/11 tragic incidences, decided we were going to tighten up packages coming into our country and the law enforcement screening of those packages. So we required all the private carriers, think of FedEx or UPS or DHL and others, all of them, to provide law enforcement with data about those packages, where it was from, what was in it, where it's going. And they had to provide that data electronically and in advance so that law enforcement could use big data and use analytics to determine what packages were suspect to be able to pull them off the line. I've been to those facilities where this happens. It's very impressive. It's also very dangerous. These packages, once identified, have to be taken into a room where there is adequate ventilation and other precautions taken, gloves and masks and so on, because of the danger of this fentanyl. But the United States Post Office was not required 16 years ago to provide that information. Instead, the legislation said that the Post Office needed to study the issue, leaving it clear in the legislative history that Congress considered it a problem, but wanted to give the Post Office time to look into it. Specifically, they asked the Postmaster General and the Department of Homeland Security to come up with a report. Never happened. So here we are, 16 years later. The post office doesn't have that requirement. These other ways you could send packages, mail into the United States do have that requirement. So guess where the traffickers go? The post office in the last year or so has begun to step up its efforts, and I'm happy about that. I believe they did it because of our hearings and because of our pressure here from Congress and because of this legislation called the STOP Act. They now say that they are screening about 36% of their packages. And again, that's a big improvement. However, there are about 900 million packages a year. That means that about 315 million packages that are being looked at is a big improvement, but we still have so many hundreds of millions of packages that are not receiving that kind of screening. In addition, we learned through our hearings and through our investigation that 20% of the time when law enforcement had identified a Postal Service package that was suspect, it was not presented to law enforcement. In other words, it went into the community anyway. So clearly, we've got a big problem. We're not screening adequately, we're not providing the information for enough packages, and we're not giving law enforcement the tools they need to do their job. By the way, with regard to the private carriers, it's 100%. It's required. So the legislation that we're proposing is to tell the post office, yes, this poison has to be stopped in every way we possibly can. This is a crisis. This is not just important, it's urgent. It's something that we want you to address. And so it says that by 2020, we have to have 100% of packages screened. And we have to give law enforcement the tools that they need. Law enforcement, of course, is desperate to get this information. If they have the information, they can help. They can help to keep these packages out of our country. They can also help to raise the price. Some packages that are stopped, of course, would have otherwise gone to a P.O. box or someone's home or to an abandoned warehouse and been distributed. There have been packages found in my state of Ohio, have been seized, that could poison hundreds of thousands of people, kill hundreds of thousands of people. There was a package found recently in Nebraska that could have killed millions of people. So in a relatively small quantity, this is incredibly powerful, dangerous stuff. So now with this legislation, we'll be able to identify more of these packages and get them offline, and again, at a minimum, be able to raise the cost, because one of the issues, one of the reasons fentanyl has taken over and pushed out some of these other drugs, and by the way, it's 50 times more powerful than heroin, one of the other drugs it's pushing out, one reason is because it's relatively inexpensive. This will raise the price and reduce the volume and help to be able to save lives. We now have over 1/3 of the United States Senate as co-sponsors of this legislation, including Senator Hatch and Senator Wyden. And again, I appreciate their support and their work on this. We also have about half of the House of Representatives that have supported the STOP Act on the other side of the chamber. It's time for us to actually take the next step, pass this legislation, get it in place, and immediately tell countries like China, if you want to send packages to us, you've got to provide this information. We have done everything we can in other ways to encourage China to crack down on these labs, these evil scientists that are making this product, and we'll continue to do that. We're taking other steps, of course, to deal with this issue in terms of increased prevention and education efforts. That's in the CARE legislation. There's $10 million right now available for the administration to come up with a national media campaign that I would strongly support. They've already started a smaller media campaign with the private sector. I support that as well. We need to push back every way we can, letting people know the dangers, including the fact that any street drug you take now potentially can have deadly consequences, including this fentanyl. Second, we need to do more in terms of getting people into treatment. This is a disease. It needs to be treated as such. And we're not going to be able to make progress ultimately unless we take people who are already addicted, get them into the treatment and longer-term recovery they need. Longer-term recovery is funded by CARA and Cures. This is the first time Congress has done this. It's very important because if you get people into a longer-term recovery program, say sober housing and group discussions, helping to support them, you have a much higher likelihood of somebody getting clean, being successful, being able to get back on track, getting back with their family, getting back with their job. Finally, we've got to do more in terms of helping law enforcement. And again, that's partly what we're doing here, giving them the tools to be able to stop some of this poison from coming in the first place. So I am encouraged with the progress we've made just in the last week. We now have a House bill that's being voted on as I speak. We now have a Senate bill that has been agreed to be reported out of committee coming onto the floor. They're identical. They both do the job. They both tell the post office, we've got to change behavior. And by the way, in terms of the post office, someone told me today that the Postal Union was concerned about this legislation. I would encourage you to talk to rank and file mail carriers, postal carriers, and ask them what they think. They don't want to be carrying this poison into our communities. They don't want to be potentially exposed to this poison should a package leak because of the danger of it. They agree, the people I talk to, that we actually absolutely have to crack down on this. We're not asking the post office to do it alone. We're providing funding to Customs and Border Protection to be there with them. The postal inspectors, the folks who are actually local law enforcement are desperate to ensure that we can do this because they're tired of it. They're tired of seeing this stuff just come in like an avalanche coming into our country and creating all these problems across the board in our communities, every sector of our community being affected. People are desperate for solutions because they acknowledge the problem. I had a teletown hall meeting last week here in Washington where I call in and speak to thousands of Ohioans at once. We do this on a monthly basis, and we have, for the last few years, been asking among our survey questions one about opioids. It's a very simple question. It says, have you been directly affected? Has anybody you know been directly affected by this opioid crisis? Unbelievably, we have gotten typically about 50% of the people on the call, again, these are thousands of people randomly selected, saying, yes, my family or someone I know has been directly affected by opioids. At the call last week, two-thirds. Two-thirds of the people on the call said they have been directly affected or someone they know has been directly affected. That's why people are desperate for a solution, because it's affecting them. It's affecting their lives. It's affecting their families. It's affecting our communities. It's affecting every single aspect of our community, the healthcare system, the foster care system, the prison system, the court system. It's time for us to step up and do more. Yes, prevention, treatment, longer-term recovery, but also helping law enforcement to be able to push back and to stop some of this poison from coming into our communities in the first place. Let's pass the STOP Act to give law enforcement the tools they need against this new scourge of this epidemic. And by doing so, we will save lives. Thank you, Mr. President. I yield back.